Good morning, everyone. It's Ange from Digestive Detective. I had such good feedback last week about the SIBO topic that we did, small intestinal bacterial overgrowth, that I thought I'd do one this week about gastro-oesophageal reflux disease, so GERD or NERD. So NERD is non-erosive reflux disease. So some symptoms that you might have of these conditions, and we know, I hear of people all the time saying, yeah, when I eat something, I get acid coming back up my throat. So some symptoms of these conditions are a burning in the esophageal region or in the throat, a chronic tickling cough that you're not doing anything or you haven't been sick and it's just there all the time, chest pain, a change in your voice. So you might get a really hoarse voice out of nowhere. Difficulty swallowing can be one of the symptoms of GERD. Watery mouth. So with this symptom, you should probably go and get an endoscope. So it's where you just have water. You feel like there's saliva in your mouth all the time. Nauseousness, constant belching with pain or without pain. Constipation is a biggie in this group. And red flags that you must go and get checked are if you've got weight gain, fatigue, if you've got a melena stool. So a melena stool is where your stool is black, essentially, because it's bleeding higher up, and when you do a poo, it's actually a black colour or really dark red. Anemia, if you've got constant anemia that can't be explained, that's a good reason to go to see the doctor. Bleeding when you have a bowel movement or from the esophageal area. So if you cough and there's blood, that should be investigated. They're all red flags that something's going on that you need to get checked over. So some of the things what happens when you go to the doctor for GERD or NERD, the doctor will usually do a couple of things. They'll put you on protein pump inhibitors or H2 antagonist tablets. So and that's what they do for reflux therapy. So a couple of things to remember is proton pump inhibitors shouldn't be taken for any more than 6 to 8 weeks because there are complications from them, and I'll talk about those in a minute. Something else that people tend to do a lot is go to the chemist and they organise to get over-the-counter medications, for example, Mylanta, Gaviscon, even quickies. So they're all good short-term things that you can do, but long-term there's consequences to those as well. And one of the things that I'd like to say to you, if you use those things and you know you have reflux, there is a better way to take them. Rather than take them at the end of the meal when you are you start to feel the symptoms, if you take them before the meal, because it then coats the esophagus and it stops the burning before the event actually begins. So that's worthwhile doing. So one of the things to remember if you are trying to come off your proton pump inhibitors with alternate therapies, you have to dose more often with alternate therapies because PPIs, they last for about 15 to 21 hours, and they're really effective at controlling the acid during that time. So if you do swap over, you have to dose much more often, say 3, 4 to 5 times a day to get the same benefit that the PPIs don't. So there's a couple of things long-term. So let's talk about the long-term risks of proton pump inhibitors. So long-term you can end up with kidney damage, an increased risk of stomach cancer, early risk of death, dementia, and the big one for me that I see quite often is osteoporosis, because those proton pump inhibitors leach calcium from your bones. They upset your mineral balance. So that is really one of the issues with them. And the adverse of over-the-counter medications like our Mylanta or Gaviscon or Quickies, or if you're in America, Tums, those sorts of medications do lots of things as well. So they can increase your risk of osteoporosis because they impair the metabolism of calcium, like I just said. So they also contain foaming agents that aren't that great for you either. They can cause you to have diarrhea if you take too many. They can build up the magnesium level that builds up in your kidneys, and it damages your nephrons and things. So they're not a good idea to be taken long term. They are not meant to be used for more than 3 years, on and off for that amount of time. But I have seen people that have been taking antacid therapy that the chemist recommended for forever, for 20 odd years. So there are some other consequences too. With PPIs, nutritional factors, you can get nutritional deficiencies because of those. So things like iron, B12, vitamin C, magnesium, calcium, and vitamin D are all nutrients that can be deficient from taking PPIs. So So the risk factors for NERD and GERD, so a high BMI, so if you're overweight, that causes intra-abdominal pressure in your digestive system, so that can also be a cause of the reflux coming back up. Smoking, they don't know why smoking is a problem, but it is. Helicobacter infection, so if you have that can cause a reflux. For some people it's genetic, there's a genetic predisposition, and it happens in more females than males, which is unusual because I see more males for it than females. So generally the age of the people who have it are 50 plus. In pregnancy it happens a lot, and I can attest to that, and that's due to the intra-abdominal pressure squeezing your diaphragm down, pushing up your lower esophageal sphincter, opening it up so the acid can come back up. Exercise, if you don't exercise very much, that can also be problematic. Diets like fast food diets, or people who do, and not always, but people who do high carb, low fat, or the ketogenic diet, because they don't feed their bacteria enough. I see it that they're actually starving their bacteria, and that tends to give them a lot of reflux. And the other thing that most people don't think about, which is a really, really important one, is stress, psychological stress, because it goes on to cause symptoms in the gut. I've just actually read this article about stress in your marriage and how that affects your gut. So I'm going to post that in the next couple of weeks, so keep your eye out for that. So when you come to a naturopath, there are some things that we would get you to do. So lose weight is your biggie, and don't eat large meals and lay down. So I'm going to go through those again tomorrow, and a couple of different ones. So I just want to talk today about what are the consequences of NERD. So for example, NERD is non-erosive damage to the gastrointestinal system, but you're still getting the burning pain, the burping sometimes. So what NERD means is there's no visible damage when they go in on endoscope. They can't see any damage. Can be generally treated with PPIs, but it's not extremely helpful. Most people find that they don't get relief from that, long-term relief anyway. And some people find they're exposed to acid, but they're not getting the actual ulceration. So this is diagnosed by a criteria called the Rome 4 criteria, and you have to have a certain amount of things in line. 3 of the things, I think there's 3 of 8 things that you have to have for 3 months that will give you a diagnosis of NERD. So one of the things that's also touted is that's because you've got too much acid, and that can be the case, but more often than not it's because you've not got enough acid, because we know as you age your hydrochloric acid reduces, and it's harder for us to break proteins down, and because we are often eating protein, that tends to sit. If we have any sort of motility issues, that causes the food to sit too, and that causes pressure in the stomach, and then the lower esophageal sphincter opens, and then the acid comes back up into the esophagus area and causes a burning. And it's not so much the acid that's the issue, it's the inflammation that causes the issue. So you want to try and get rid of the inflammation. So the consequences of GERD that are problematic is it can lead to Barrett's esophagus, esophagitis, an erosion of the actual mucosa of the esophagus. So once that happens, it can go on to cause cancer. So you want to sort of get to it before that happens. So that's all for today. So that's just giving you the basic outline. Tomorrow I'm going to talk about some foods you can eat, what you can do in your life that you can change this sort of constant acid reflux, and then I'm going to talk about some herbs that you could possibly take and some supplements that you can take that will be helpful. So I hope that's good. Have a great day. I will be posting things about how to, some articles about GERD during the day, so you can have a look about some other things that other people have written that are useful. And if you found this useful, could you share it for me? That'd be terrific. And I'll talk to you tomorrow about those other things. I look forward to it. Have a great day, everybody. Bye.